Good morning and welcome to today's webinar, Employee Benefits Healthcare Trends Insights, presented by our sponsor, Heffernan. My name is Michelle Wilcox and I will be your moderator today, and I will also be monitoring questions you may have during the session. Before we open up the session, let's review a couple of key items. If you have trouble with your internet connection during the webinar, we recommend leaving the presentation and logging back in. We do not control the audio, your devices do, so if you have an audio difficulties, try adjusting the volume settings on your device. If a telephone line goes down during the call, hang up and call back again at the same number. If all lines go dead, watch the on-screen chat box for an alternative call-in number. Feel free to ask questions or provide feedback by using the questions box during the webinar. If you're using a tablet, you may need to tap on the screen for the options bar to appear. Then you can select the appropriate option. We may not respond immediately, but we will work your questions or feedback into the presentation. Presenter is going to be taking questions at the end, so we'll be sure to get that to you. If we can't get to your comment or question during the session, we'll be online afterwards to respond, or we may follow up in an email if we run completely out of time. You may also email us at moderator@aspenrmg.com for up to 48 hours after the webinar. This will be a 1-hour presentation. Questions and comments are very much encouraged throughout, and the presenter will be answering questions at the end. And lastly, we have a number of upcoming webinars covering a variety of topics, including those listed at the Heffernan webinar website. With that, let's begin. We are having a little bit of technical difficulties, but I think we're working through it, and I do see that our presenter, Jenny Coyle, is finally able to access the presentation. Jenny Coyle is Senior Vice President of Underwriting and Compliance. She joined Heffernan Insurance Brokers in March of 2012 as a technical analyst to assist the Northern California Services team in underwriting functions. In January 2014, she expanded her role to manage the Employee Benefits Underwriting Division for Heffernan nationwide. Jenny began her career in employee benefits almost 30 years ago after receiving her bachelor's in economics and international relations from Cornell University. Before coming to Heffernan, Jenny worked as an underwriter analysis for major medical carriers. As the manager of the underwriting and financial analysis department, Jenny's primary role is to ensure that our service and sales team have the tools and resources to support our clients, including the ability to provide a comprehensive analysis of an employer's benefits program and the associated costs. A critical component of a client's financial analysis and renewal planning is to understand the trends in the marketplace. Each year, Jenny tracks the reports on insurer and employer healthcare trends in our annual trend report. Jenny is passionate about helping companies lower costs while providing an employee benefits program that will retain and attract top talent by developing tools, resources, and training programs for our exceptional Heffernan teams to deliver these objectives directly to their clients. So again, I'm going to go ahead and Jenny, can you hear me?
I can hear you, yes.
Oh, awesome. Okay, so I'm going to go ahead and turn this presentation over to you, and we'll get this ball rolling.
All right. And everyone can see my screen?
Yep, we're good to go.
Great. All right, well, thanks everyone for joining. Today we are going to be going over the results of our Heffernan's annual trend report. This report is broken up into two key sections. The first is the 2026 prospective carrier trend projections. Trend is the projected percentage increase in the cost of healthcare from one year to the next, assuming that no changes to the benefits are offered. Insurance carriers assess changes in utilization rates, price inflation, and technological advancements to determine their trend projections for the upcoming year. It is important to keep in mind that trend is not the same as the renewal increase. It is the most important factor driving that renewal increase, but it's not the only one. The second part of the trend report is to understand what's going on in the benefits landscape. This section helps employers to understand what might be driving trends and to get a deeper understanding of the benefits marketplace. So with that, I'm going to go ahead and roll into our national trend projections. What you see here are our trends broken up into 5 key regions. And our national trend here at the bottom is 9.8%. This includes all different types of medical products, PPOs, HMOs, HSAs, and RX, all into a wrapped up combined trend based on the product preferences in each of those regions. What we are seeing, unfortunately, is another year of really high trends. The national trend projection for 2025 was 9.0%. So going into 2026, we're looking at trends that are higher in almost all of the regions. It is the same for 2026 in the West region as it was in 2025. But almost all of our other regions and national are almost 1% higher than the projections in 2025. Going a little deeper, we can see what those trends are broken up into the main medical products combined with an RX projection. So PPOs are by far the most popular plan that employees are in. And you can see that almost across the board in most of the regions, we're looking at almost a 10% trend for those products. CDHP plans are consumer-driven health plans. These are your HSAs and your HRAs. Those also are seeing similar trends to the PPO across those regions. And those CDHP plans are the second most popular, followed by HMOs. HMOs are most prevalent and most common in the West and also in the Southeast there. Looking at the trends on a regional level, we break it down even further. So we have the overall West trend that you were seeing before, and then the trends broken out into key states. The states that we show the individual trends for throughout the trend report are the ones where we have enough results from a significant amount of carriers to really understand what the core trend is there. What you can see here is a big difference between the HMOs and the PPOs. Again, HMOs is not the most common product, but it's where you'll find the highest enrollment across the country is in the West. There was a large correction in the HMO market in 2025, and so those trends are a little bit lower in 2026 than they were last year. But PPO is rising, which does give it that high trend here. Moving on to the Southwest region, it's a large area geographically, not too many different states here. Some of the core states are also seeing a variance between these trends. If you look at Texas, PPO is flip-flopped from HMO, and New Mexico as well. You're seeing lower PPO trends than you probably are in any other places in the country. In the Midwest region, high trends last year. This trend was much lower. This is a large area also geographically, and we've got a number of trends. Some of our key states in this area are Missouri, but the trends here in the Midwest are very consistent across products. The Northeast is probably the highest trends that you see throughout the country, with some variances in a couple of states, a lot of different states, but a large population here in our Northeast region. And then finally, final region here is the Southeast region. A little bit lower, similar to the West Coast, and part of that is being driven by the HMO correction that's already happened. So having a good understanding of where these trends are going, we'll have the full report, can help you predict costs coming into the 2026 plan years. Moving on to dental and vision, we have the 3 key dental products, dental HMO plans, PPO, indemnity, and then we also have vision. The dental HMO is up from 2.7 in 2025 to 3.6%. It is not the most common dental plan. That is the dental PPO plan there, and that is up just a tenth of a point from 4.6 to 4.7%. And then our vision has a slight downtick. It was 2.8% in 2025, coming down to 2.7%. So the dental and vision trends are seeing just a little bit of variance, but nothing near the volatility of what we are seeing in medical trends, and much more in line with overall inflation there. So the second part of the report is really understanding where these trends are coming from and looking at the employee benefits landscape. The first thing we're going to look at is what the self-funded market is doing. This shows you here the overall growth of self-funded and how popular it is among different size companies. So overall, about 63% of companies do self-fund their plans, with the largest percentages being for companies that have over 1,000 workers. 200 to almost 1,000 has about 61%. And then even some of the smaller companies are self-funded. This doesn't include level funded plans, which are self-funded, which would bring that 50 to 199 up to about 45% when you take that into consideration. A lot of companies now, because of escalating costs, are trying to get better control of their cost. And so we're seeing more companies move into different types of alternative funding. And one of those first steps is HRAs. So HRAs are a way to self-fund the deductibles and out-of-pocket maximums of a fully insured plan. It gives you insight into the claims and the utilization rates of the company, and does allow some first dollar coverage in some setups for employers. They're really growing in popularity because it gives a little bit more information about how the plans are running. Another plan that is not technically self-funded but is rising in popularity are the ICHRAs. It is a form of an HRA, and it is a replacement for a employer-sponsored plan that allows individuals to purchase marketplace insurance subsidized by the employer. Employers do have to choose whether to offer a group plan for that segment of a population, or to go and just subsidize the individual market. It's a great benefit for some of our smaller companies, but those that want to have a robust group plan tend to avoid the ICHRAs. But it is something that we're seeing more and more interest in, and is definitely worth having a conversation about to understand if it is the right solution for you. Another way that employers are diving into the self-funded realm is by looking at level funded plans. They are definitely not new to the market. They've been around for decades, but we are finding that more and more carriers are offering level funded plans. It's a way to get access at the claims information, gives the employers a little bit more control over their costs, but still has predictable rates and premiums that they pay. When companies get a little bit bigger, we're also seeing the rise of group medical captives. And it's a way to pool some of that risk, and is usually a good stepping stone for groups that are fully insured that are looking to move to self-funded. And then of course, self-funded remains popular. So even if you are, really fully insured and that's the world you really want to make sure that you are exploring all of these types of funding as options to make sure that if you do stay fully insured, that you're doing so knowing what options are out there. Looking at the self-funded market does allow us some insight into what is going on in the landscape in terms of large claims. What you see here is a chart that was published by Tokio Marine, and it shows the growth of million-dollar claims. So since 2013, the number of claims that exceed a group's specific deductible by at least $1 million has risen 333%. 10 years ago, a catastrophic claim was a claim that was over $1 million, and now it's become even more common to have those. And a catastrophic claim would be a claim that's really over $5 million. So we're seeing all of these claims not just occur more frequently, but also become more severe. Very few million-dollar claims, though, are attributable to one condition. Usually there is a lengthy hospital stay, complications, or comorbidities that will make a claim that on average might be $500,000 turn into a $5 million claim. So it's important to make sure that employers are aware of ways where they can help manage claims. Promoting enrollment for high-risk patients into disease management programs can lessen the severity of many conditions, and also making sure that there might be a case management to prevent the comorbidities from developing. Looking at the types of conditions that you might see most frequently on a large claims report, we have neoplasms and cancers as number one. Cardiovascular diseases and musculoskeletal conditions are the most frequent large claims that we see. But these claims are not the ones that always develop into the multi-million-dollar claims. The highest claims that we see are usually the congenital anomalies, transplants, and then newborn or neonatal care. It's important to really recognize the difference between a high claim that can occur frequently and those claims that really can have those runaway high costs. Both of them are of concern, and both of these factors are driving some of the higher trends, the growth in these large claims. But you really want to look at it from a rating perspective a little bit differently. Understanding that claims trend is growing, I have a quick example of what leverage trend is and how it really affects all of the medical market. So let's say in year one, you have a claim that is $200,000. And if you're self-funded, the employer is on the risk for the first $150,000, and the stop loss carrier is at risk for the $50,000, since they have a $150,000 stop loss. If the claims trend is 8%, that $200,000 claim is going to grow to $216,000. If the employer doesn't make any changes to their specific deductible, then the growth to the stop loss carrier from 50,000 to 66,000 is a 32% increase. And so that means if there aren't any changes in the risk that the employer is taking on and growing that specific deductible, they're going to be getting much higher premium increases because the stop loss carrier is taking on so much more. In this last example, if the employer grows their specific deductible by 8% in line with trend, so they increase that to 162, then the stop loss carrier also their liability grows to 54,000 by 8%, and you're likely to get a much more favorable increase, or even, a flat change to the premium that you pay. In a study, another study by Tokio Marine, a group that changed its specific deductible every year for 4 years would have seen a premium decline by 0.4%. And a group that didn't make any specific deductible changes on average would have increased 11.1% each year. So we are definitely not recommending that you always increase your specific deductible, but we want to make sure that you keep that in mind and know that that plays into the increases that you are getting, and always keep it out there as an option. The next subject of the trend report is looking at provider networks. I'm sure that recently you might have been seeing headlines in the news about carriers and health organization contracts. While this isn't something that's new, we've seen this happen many times over the last few years. The frequency of these potential disruptions have increased, as well as the length of time it takes to come to an agreement. While most carriers and health organizations are reaching an agreement, it is coming at a cost. So what we are seeing for provider networks is that many hospitals and providers are seeing staffing shortages, increased utilization. The number of providers out there have gotten smaller because of all of the mergers. And all of this is leading for them to demand a higher rate from the carriers that they contract with. They have higher staffing costs, and the multi-year rate guarantees between hospital systems and providers and the carriers means that they're locked into a reimbursement rate for a number of years, even if trend and inflation really do increase. So they are looking for more money. And so as a result, we are seeing much higher network costs and some network disruption. Although I will say most carriers and the providers are coming to an agreement. There is sometimes it's happening after companies' renewal dates, and they might have some time where those providers are not in their network. They might be asked to look for other providers and then come back, and there is an agreement afterwards. So it is pretty volatile in the provider networks, and the request for higher costs is a big driver of the trend increases that we're seeing now. And this isn't unique to dental. We're also seeing dental network shortages. You might have already experienced longer wait times to get into a dentist, having to pay out of network costs because your dentist is no longer in the network, or just an inability to find a provider that is accepting new patients. Part of this is that there's an aging dental workforce that's not being replaced by new dentists. Dental schools have limited capacities, and so they're not getting all of the new dentists out there to keep up with the amount that are retiring. And also, because there's such a high demand for dental services, there's increased awareness about oral health. Dentists don't necessarily need the providers at that contracted cost in order to get patients that they were before. And so you're seeing a lot of dentists choosing to not even enter into network contracts. So a lot of volatility in the dental provider networks, and that's definitely something to keep our eye on. So something else that the trend report has been exploring is really the kind of the perception of the health insurance in the U.S. today. On December 4th of 2024, the chief executive of United Healthcare was fatally shot. And then when CNN reported that the killing, it was prompted a flood of social media posts complaining about medical claim denials. Many people were shocked at the sympathy or the seeming sympathy and support for that killer, and it did create this sentiment that health insurance carriers are sacrificing the health of their members to enrich themselves. And that was the kind of general perception that had been out there. Some statistics, 28% of Americans say health coverage is good or excellent, which is down from 41% in 2012. And most Americans believe that that the health system really is flawed. So this really is a catalyst for, a broader conversation about healthcare and really the need for improved transparency, reducing the claim denials or understanding those claim denials, and to make sure that patient care is really prioritized over financial considerations. So what really is driving some of this unrest or this perception in the industry has been the idea of AI-enabled claim processing. There are definitely benefits to AI processing claims. It can speed up the approval process for straightforward claims. It helps with fraud detection. AI can look at doctor's notes and other unstructured data to really get a fuller picture of a claims situation when it's processing. And obviously it can quickly analyze and process large volumes of claims data, reducing the time to handle each claim. So the problem isn't in the straightforward claims, which are benefiting from AI, but when it comes to denials. So there is a belief that prior authorization denial rates have increased, and the fear that these denials are lacking human oversight and nuanced judgment. And I know that the carriers have responded to this and are working to make sure that they're using AI to approve things and working towards reassuring our members that when denials are made, that there is that human touch that is evaluating and really looking at the situation. Other reasons for dissatisfaction are that the cost of care has risen even with medical insurance. So whether it's because deductibles and out-of-pocket maximums are so high, or just the exorbitant cost of some prescriptions, there are many people who are enrolled in a medical plan that are still foregoing medical procedures or not filling their prescription drugs. And then also the access to care. So finding in-network providers, long appointment wait times, inconvenient appointment times are other, reasons that Americans today are concerned with the American health system. Ways that employers can help. Earlier, I had mentioned HRAs. It's a way to provide first dollar coverage. It can reduce premiums, and that would mean if initial care is covered by the HRA, then you might see more patients being compliant and doing the procedures that they need to stay healthy and maintain their health. We are seeing an increase in not just telehealth service, but true virtual care options. And this helps from both a cost perspective, but also in that access to care. And really looking at targeting and crafting employer plans based on the demographics all over the country of your population. So we have gone through a lot of phases in the healthcare system where there might have been plans specific to certain geographical areas. And then there was a push to have everybody on the same plan. And I feel like now we're moving a little bit more into crafting different options for our different populations. Our generations are looking for different types of healthcare services. Our millennials versus our Gen Zs versus our boomers want different things from their plans. Whether people are in more urban or rural areas, they have different needs. And so crafting plan designs to meet those different populations' needs will go a long way to creating more satisfaction with the plans. So you can't talk about healthcare without really looking at what's going on in pharmacy. Really, the biggest innovation trends that we see in healthcare are in the RX space. Here are a few of the biggest pharmacy trends. So starting with cell and gene therapy, the list of approved cell and gene therapies is long and continuing to grow. It's most commonly used to treat cancers, but there are a lot of exciting new developments in other kind of rare genetic diseases and blood disorders. These do come at a very high cost, and you want to make sure that you're aware of whether or not these are even included in your plans. There are some exclusions around cell and gene therapy, but it is something that has offering cures for diseases that in the past were incurable. So this development, is exciting in RX. Another trend that we're seeing is AI drug discovery. One of the leading costs for drugs as they come to the market is that the success rate for the testing of drugs has been about 40 to 65% to even get through phase 1. So it takes a lot of money for a drug to even make it to the marketplace. But the drugs that are AI discovered drugs have a success rate of 80 to 90%. So if in that first phase, more drugs are making it through and getting into development, then this $2 billion to bring a new drug to market will decrease and potentially bring down the costs of new treatments that are entering the marketplace. So more to come, and I expect to see more on these AI drug discoveries. Another development is the personalized 3D printed drugs. The difference is it uses additive manufacturing versus subtractive techniques. Not a pharmacist, not fully sure what that means, but it is allowing for personalized medicine. So they can make a drug taste like cherry for the kids to allow them to be able to um, better, want to take it. Or for senior citizens, it can remove or add things that they need, so then there are less drugs that they might have to be taken. So it's a way to really personalize the pharmaceuticals that a patient might be taking. And then, of course, we have the rise of GLP-1s, originally developed and used for diabetes treatment, but there's a lot of increased usage for not just for weight management, obesity, but also for coronary heart disease, stroke, and certain cancers. It does come at a big price tag, and I'll mention that a little bit in an upcoming slide there too. Looking at all of these developments, you can see they do come at a pretty high price point. US pharmaceutical expenditures increased by 13.6% between 2022 and 2023 to reach $722.5 billion. The increase is being driven by partly by utilization, by new drugs, and price. So semaglutide, which is the main ingredient in some GLP-1 drugs, is the number one drug from both price and not from its manufacture price, but from the overall expenditure on that. And it's also very high up on the utilization rate. So that is, the GLP-1s, while they do have some predicted good benefits in the long run, are a cost that we're seeing and a big driver of pharmacy costs today. Looking at the top 10 most expensive drugs, number one is Lenmeldy, which costs $4.25 million. It's a gene therapy used to treat children with metachromatic leukodystrophy, a rare hereditary disorder that causes fatty substances to build up in cells, eventually damaging the nervous system. But the thing with a lot of these really expensive drugs is that they are typically one dosage, and often they are curative. We're seeing more drugs that are used to treat and even cure hemophilia. And so even with this high price point, curing some of these conditions can lower costs in the long run, especially for some of these conditions that involved expensive treatments year over year. Another focus that we are looking at is really women's health. Historically, women have been underrepresented in health research. And prior to 1993, there was a law in 1993 that mandated that women be included in clinical trials. Before that, women were rarely included. And I'll cite the case of thalidomide, which was a tranquilizer that was marketed as a treatment for pregnancy-related morning sickness in the 1950s and the early 1960s. The drug was not tested on pregnant animals before being given to pregnant women. And the drug caused thousands of miscarriages, and more than 10,000 babies in 46 countries were born with severe abnormalities before the drug was removed from the market. And the reason for this is it was more costly to house both female and male animals. And so many research studies only conducted studies on male mice. And because of this, we are really behind on understanding how some diseases and drugs impact women differently. There's always been an assumption that treatments that were safe and effective for men were also safe for women. But even if you exclude pregnancy complications, this is found to be not true. Painkillers have been found to be less effective for women. Women also metabolize many drugs more slowly than men, which leads to higher concentrations of the drug and a greater risk of side effects. And then some diseases affect women differently. And we're just starting to understand, the difference between how heart conditions, Alzheimer's, affect women in a way that's different than men. Some of the symptoms present differently. And so the growing increase of women in these studies are helping to make women's health a little bit better. But again, we're still behind the ball, but we are seeing some positive changes. Some recent studies show that women's pain is dismissed more than men's pain, and that women spend 25% more of their lives in debilitating health than men. But the fact that there are now studies showing this does mean that there's progress. We're seeing interest in research in women's health has been growing, as evidenced by the Women's Health Initiative, which looks at cardiovascular disease, cancers, and other conditions. There are more recent initiatives that are investing more money into research and clinical trials to better understand how diseases affect women and how to improve health outcomes. In addition to some of these studies, we're also seeing an increased campaigns to destigmatize menopause. 86% of women going through menopause experience symptoms, while 62% reporting that it affected their work. Women experiencing perimenopause and postmenopausal systems make up an estimated 20% of the female workforce, and yet there has been very little recognition on how the symptoms of menopause can affect their work life and work opportunities. Over the last several years, there have been major strides in the workplace to support fertility, pregnancy, and postpartum health. And then employers that similarly invest in supporting women through menopause will see increased productivity, employee engagement, and retention. So we are seeing progress in women's health, and hopefully we will continue to see more of it. And lastly, the trend report really explores big data and how that's changing healthcare. Healthcare data creation has surged thanks to the rise of telehealth, digital records, and smart devices. The healthcare industry generates approximately 30% of the world's data volume, and that's expected to grow to 36% by the end of this year. This surge in data is reshaping healthcare delivery and management, offering new avenues for improving patient outcomes and operational efficiency. Some new laws have also affected the availability of data for both patients and researchers, such as the 21st Century Cures Act, which aims at accelerating medical research and innovation by improving the flow of electronic health information. But really, how is this health data being used? Just as in other industries, the healthcare industry—
Oh, Jenny, you cut out. I don't know if you can hear me or not.
I can hear you. Am I still? Can you hear me?
Okay, you just cut out for a minute. Okay, you're good. Go ahead.
Okay, I'm back. Okay, I'm wrapping up soon, so hopefully it lasts. How is health data being used? Healthcare industry uses data to increase operational efficiency, it personalizes services, and empowers decision making. But there's obviously some very real concerns about the quality and privacy of the data and everything that's out there. A major contributor to the skyrocketing costs of healthcare has been the lack of price transparency. There's wide price variations for the same procedures, hidden fees, and surprise medical bills are common. By disclosing the actual prices of medical services, healthcare providers can pinpoint efficiencies and develop cost-saving strategies. But there is concern about the type of data. So poor or incomplete data would just be one issue, but we also have to make sure that the data that we're getting is really credible data that leads all of us to make better decisions. For example, data that only focuses on one sector of the population, like when we're reviewing women's health, if it's only looking at conditions for men and that data, it may not provide accurate insights into the health care of the whole population. And so it's making sure that with all that data out there, that we're really trying to focus on getting good data and leading it to make better decisions. And obviously, privacy is another major issue. Unfortunately, medical data isn't valuable only to research who want to improve health outcomes. It's also valuable to criminals. Some say that medical data is 50 times more valuable than credit card numbers on the black market. So these privacy concerns must be addressed to ensure that the benefits of data-driven healthcare are fully realized. So we'll continue to look at data, the information out there. We want our employers to have as much as they can and push our industry, to have good, credible, and safe data. So those are the major topics that we covered in our 2026 trend report. You can access the report on our website. And with that, I'd love to open it up to any questions that anyone has.
Thank you, Jenny. We had a little bit of technical difficulties, but we made it through it, and it was a great presentation with lots of information. We do have a question. In all your years studying the national health insurance industry trends, which aspects of the current trend reporting period do you find to be the most unusual or the most impactful compared to historical reference?
So I wouldn't say that there's anything that's really new. I think it's just the combination of factors that we have seen over time that are impacting us this year. So, for example, the health shortages or the staffing shortages that we were seeing started before the pandemic. They were definitely accelerated by it, and we're still seeing that. And that comes together with this explosion in RX technology that is driving costs. And so it's almost like we're seeing a perfect storm. So there have been RX explosions before. 2014, we saw high RX, but we weren't seeing the increase in utilization that we are seeing now. So it's nothing that is new that is driving it, but more just a combination of many factors kind of coming together at the same time.
Great. Well, it looks like we finished up a little bit early, so I want to thank you all for attending today's webinar presented by Heffernan. We will send an informational email with instructions on how to access a copy of the presentation on our website. Thank you, Jenny, for your time and expertise today. We hope all the attendees found today's webinar to be a valuable use of your time. Be sure to join us on September 9th for our Managing Difficult Employees, 15 Types of Employees Who Challenge Us webinar. Thank you all and have a great day.
Thank you.